Good afternoon, team. Otieno, confirm you can hear me.
Yes, Sungok, good afternoon.
Thank you. I can see we are still quite few. We are hardly 100. I want to request that we use our channels to mobilize a few members to join, or other members who are meant to join this call. And as usual, I think we'll purpose to start our meeting at 10 past, our training rather, at 10 past 2. So let's use the 5 minutes to reach out to our other colleagues to join. We will begin at 10 past 2. Thanks. Great. So I think we can we can begin because of time. Good afternoon once more. Let me take this opportunity to welcome all of us to our virtual KenyaEMR training. This is one of the many series that we've organized. I think it should be our 4th one. My name is Franklin Songok. I work at NASCOP. I want to request one volunteer, especially those who have the mic, to lead us in a word of prayer. Ogutu, I don't know whether are you in a position to pray for us or to say a short prayer before we begin. Can I be heard? Otieno? Can you hear me?
Let me pray.
Okay, Lydia, go ahead.
Thank you. Let's pray and believe. Father God, we thank you for this moment you have given unto us, my Father. As we do our deliberation, oh God, we ask for your guidance, your hand to be with us. Let everything that we deliberate and we train, my Father, let it be easy to our understanding, oh God. We give you praise and honor. This we believe and trusting in Jesus' name. Amen.
Right. Thank you. Thank you very much, Lydia, for leading us in the word of prayer. Today we will be focusing majorly on case detection in our training, case detection and case management, of course using KenyaEMR3.x. Allow me to share our agenda so that I can just walk you through the agenda very quickly, and then we begin. Just give me a minute. Okay, Lydia, confirm you can see my screen?
Yes, we can.
All right, thank you. Yeah, so this is what we intend to cover today afternoon. I think I've already mentioned the topic of discussion, and our training objectives are: one is to understand KenyaEMR3.x features that support HIV case detection and referrals. Of course, that will also include machine learning features, the features that have been incorporated within the system. This is not scrolling. Yes. Then number two, we should be able to take you through a demo that will illustrate HIV management features for case management to improve patient treatment outcomes, and we'll also be able to take you through take you through the HTS specific reports, just to so that you're able to appreciate what we've been able to do in terms of program monitoring, and because that's the key output at the end of the day for any manager or any leader at the facility, a county, or at the national level. So this is our program basically. Otieno will take us through the first part of the presentation that will focus. It's a slide deck really to introduce and just prepare us for what will come in form of a demo. So Adeline Mioyo will take us through the first demo, which will be looking at the HTS workflow, the contact listing for HIV positive clients, those are the recipients of care, and the linkage process for HIV negative for prevention services, and the HIV positive for those who will be linked to care. And then Lydia will also take us through HIV case management process, looking at the definition of case managers, linking patients to case managers, documentation of cases, and managing the encounters, and of course discontinuation of cases, and finally she'll also be able to take us through the reporting bit. Then after that, we will open it up for plenary. Allow me to just make one announcement. In case you have any questions that probably you want responded to, you can post it on the chat wall. We have a team that is ready and available to respond to any of the questions that you will raise. But of course, if you feel you want to verbalize any of your questions, you can also, we'll give you an opportunity towards the end of our training so that you can ask your questions. We want to appreciate the feedback that we keep receiving. from the previous virtual trainings that we've held. I think that is what builds us. That's what makes us respond to your needs and ensure that all of us are on the same page in as far as navigation and utilizing EMR for case management or managing our clients, following up our clients, and of course for reporting purposes. So at this point, I really don't want to spend a lot of time with the preliminaries of opening remarks and all that stuff. I think we can do that at the end of our virtual training. So at this point, allow me to welcome Bernard Otieno, who will introduce himself and then take us through the first part, which is a slide deck. Otieno, once you're done, you can usher in Adeline. Adeline, once you're done, you can usher in Lydia, who will take us through the last part, then I'll take it up from there. However, in case you have any questions, I repeat, kindly post on the chat wall. We'll be able to respond to any of your concerns. Thank you, and over to you, Otieno.
Yeah, thank you very much, Songok, and good afternoon, everyone. I'd like to just share my screen, so maybe Songok, you can confirm if you are able to see it from your side.
Yes, I'm able to.
You can confirm if you're able to see.
I can see your screen, but not the slide deck. So I'm seeing your screen saver.
How about now?
Not yet.
Not yet?
Bado.
Okay. Just a moment. How about now, Songok?
Not yet. I guess probably it's still loading. Is there anyone else who has access to the slide deck, Otieno? I know I have it, but I may not project from my end because my.
Just a minute. Let me just change my network. I think it will be a network issue.
Okay.
Okay, Songok, I think it should be visible from your end now.
now visible. You can put it
You
on
see the
slideshow.
presentation as well?
Sorry?
Are you able to see the presentation?
Yes, you can now just put it on slideshow and then proceed.
Yeah, thanks. So sorry for that. Those are just internet challenges, but I think we can continue now. So I just want to take a maximum of 5 minutes just to introduce the topic, our topic today, where we would like to take you through the
Okay, now, is
HTS.
it on? Oh yeah, it's okay now. It's okay. Sorry. It's okay. Proceed.
Okay. Yeah. So we just want to take you through the HTS workflow as well as the HIV case management in KenyaEMR3.x. I know we have done this before, probably on 2.x, for those who have used the KenyaEMR3.x for HTS. And I also know that there are a number of facilities that are currently using 3.x, and maybe you got through the HTS continuum and recording the process in the system. But I think we have a number of people who are seeing this for the first time, or maybe some of you guys have had challenges using this particular module. So today is just an opportunity for us to take you through this so that you can learn in terms of what is the process, how do we use this particular module for HTS case finding, as well as how do we use the case management module also for the HIV case management. Yeah, so for this presentation, I'll just take you through a bit of introduction and overview. We'll look at the key features in KenyaEMR3.x that supports HTS and also for, the case management. And again, also we look at some of the reasons why you need to use this module for the HTS work, and also for recording all the HTS processes, as well as manage your cases through the case managers and having all those encounters within the system. After that, we'll have a short demo, just going through that by my colleague Adeline and Lydia. So key points to note: one is that HTS has been is one of the modules that have been onboarded in KenyaEMR3.x. So if you've used it before in 2.x, I think this is now a great opportunity for you to now use it on 3.x. And if you've been using it in 3.x, now you do have to take time and see how you've been using it vis-a-vis how it should be used. So maybe if there's something that some issues that you've been encountering, is an opportunity for you to look at the process and maybe ask questions. Then our team will be able to respond to you. Again, also, this module supports HIV testing protocol as per the Ministry of Health guideline in Kenya, and it enables robust documentation and recording of testing and test results, and also capturing all the demographics, the testing points, and the linkages processes, as well as facilitates on-demand reporting for facilities, county, and national, through various platforms like reporting through HTS, as well as the National Data Warehouse for MOH and also for programs. Yeah, so as I've said, KenyaEMR3.x introduces an enhanced HTS workflow, which optimizes case finding process through innovative technology. As we'll be able to see, for some of you who have seen the predictive model, the machine learning that predicts the risk category for different patients in terms of their possibility of turning either positive or negative, which again also kind of help in resource management, so that we have targeted testing. We don't waste, the facility doesn't waste testing kits necessarily, especially for the patients with very low risk of turning HIV positive. Again, also for case management, the system strengthens HIV case management by providing a very robust feature that can support you in terms of designating the case managers and also linking the patients to the case managers, so that they're able to follow through the particular cases to ensure that we have better patient outcome and also personalized patient care, especially for the patients with the high viral loads. So there are key features in KenyaEMR that support HIV case detection and also case management. And as I already mentioned, the module supports the client registration, patient screening, then also through the innovative technology of machine learning, we can achieve targeted testing through the risk profiling process. We have the test result documentation, and also there's a contact listing through PNS and family features. We'll be able to see that. And again, also, the system now supports the status neutral linkage feature. Whether you're positive or negative, the system provides the feature for linking you for either preventive services or HIV management services for patients, for the cases that turn positive. For the cases that turn positive over time, the system also provides features for HIV case management through different case managers, and we'll be able to see how that works. And finally, the system also has reports around the HTS for program as well as for MOH. And again, as you'll be able to see. So after all said and done, why is this module important for us? One, it helps to achieve standardization in terms of compliance with the national testing algorithms for Kenya. And also it brings efficiency in terms of the reduced paperwork and also the duplication of records because of unique identification of patients. That kind of prevents duplicity in terms of patients being registered in the system more than once. Then also it helps you to achieve better quality by improving data accuracy through various validations that have been provided. And again, also it ensures there's completeness of data, again, through validation, especially for the fields that are mandatory. And again, because of this, if used correctly, it leads to timeliness in terms of reporting and data availability for the facility, also for the program as well. Again, also, it supports linkage, especially for the patients that turn positive or turn negative. For the positive patients, the system provides a way to link the patient to HIV management, and also for the negative patients to preventive services, as it were. Then the last bit of that is the cost effectiveness, again, also optimizing the use of technology to kind of minimize wastage of testing resources, and this is through the risk stratification and also targeted testing for patients with high risk of turning positive. Yeah, so we are told that if used correctly, this particular module will enhance evidence-based decision making for both partners and MOH. And I think up to that point, we'd like to now just transition to the demo part, so that then we can see this in action, how the process happens through the KenyaEMR. So I want to stop it at that and give way to my colleague Adeline to just maybe start us off from the HTS workflow before we usher in Lydia to take us through the case management. Thanks, and over to you, Adeline.
Thank you, Otieno, and good afternoon, everyone. As Otieno has mentioned, my name is Adeline Mioyo, and I'm going to take us through this session. Otieno, kindly confirm if I'm audible from your end.
Loud and clear.
Okay. So as Otieno has mentioned, I'll take us through a HTS bit. Allow me to share my screen. Jenna, confirm again, you can see my screen from your end?
Yes, I can see.
Okay. Thank you once again. So I'll just start us off by logging into the system. This is the process of logging in. If everyone is given their login rights, then this is how they'll be able to start to log in. This is what you see when you log into KenyaEMR, and you key in your username and your password. So I'll just log in that way. People who are familiar with the 2.x version, this is now the new login page. This is the default login page that I know the 2.x was different, but now this is the way it looks like. This is the landing page for KenyaEMR. Now we are using a UAT as a test server. So I know there are teams that will be able to see Taifa Care up here instead of KenyaEMR. So once you log in, this will be your landing page. What you can see on your right, these are the modules that you'll be able to see, unlike what we were used to in KenyaEMR3.x. So once you log in, this is what you'll be able to see. You'll be able to see your active patients and just the modules on your right hand side, and we have the navigations on your right. Then we have modules on your left. So if you are registering a patient, depending on the facility, there are facility teams that registration is done by HTS providers. And there are also facilities that HTS registration of a patient is done from somewhere else. So if you are HTS providers and you're doing registration, then you would start by registering a new patient. You can see the buttons here. The first button is to search for a patient. Then we have these small buttons. You'll be able to get other modules here that we'll talk about later. Then where we register a patient is the button that says add a patient, the one with a plus sign. So if it's a new patient, then you'll be able to click a plus sign and just use the normal registration form that we are used to. The form is the same. The details are the same, where just the look and feel of it is what is different. But the details of the patient, you'll be able to just enter the details of the patient here. The address where the patient is coming from, the contacts, you'll be able to fill all the details of the patient and register this patient. Then if this is a new patient, these are a revisit patient, then you'll be able to search them here. If you search a patient, for example, you search John, then you'll be able to see, you can search them using any other identifiers that you used during registration. You'll be able to find your patient and just give them the services that they have come back for. So in our case today, we are going to search. I already had registered a patient, so we will not start from registration. The registration is the same. So I already have registered a patient called HTS for purposes of this demo. So when you search this patient, you'll be able to open the patient summary here. What you can see, all these are what is available for us. But today we strictly limit this demo to the workflow of HTS. So once you have an HTS patient, I've already checked in this patient. If the patient, for this, our patient is coming from somewhere else and not directly HTS. So this is where you will be able to check in a patient. If you are registering a new patient, you just add this visit. But this patient that we already checked them in, if you add this you say add visit, then you'll be able, you'll be able to add just visit type and any other billing, if patient is being billed, and then queuing and save. But for our patient, we already checked in, so I'll just discard that check-in process. Then once you have the patient in front of you, on your far right, we have these buttons here. So one of the buttons, the last button, is the button that has all clinical forms. So as a HTS provider, if you open this button, you'll be able to see all forms that this patient is eligible for, we have encounters, but for today, we'll only restrict ourselves to HTS forms that we are seeing here. For here, we are able to see HTS self-test form. We are able to see eligibility screening form. We are able to see initial form and retest form. There are other forms that will drop the moment this patient is also a linkage form will drop the moment this patient is tested and turns positive. So for our case today, we'll start with the eligibility screening form. That's the way it is done in the facility. So when you click on the eligibility form, I'll just go quickly, so to purposes of saving time. So we'll start off our patient. We can choose population type. We say this our patient is a general patient. Right now, I'm now a HTS provider. We click there, no disability. The department that we are covering is OPD. These are hospital patients. This is not a healthcare worker. You can select if the healthcare worker, you can say yes or no, but for this patient, we just say no. If the client has any relationship with the index client, we just say none there. What is the strategy that we are using for this patient is the PITC. If it's an outreach, you can choose any of these strategies that we have here. But for our case, we'll just pick PITC as a strategy. Then we also pick OPD as an entry point, but there are various entry points that one is able to choose from depending on the setup of the facility or where the patient is being tested from. So for this purposes of demo, I'll just choose OPD. A history of HIV testing, if patient has been tested before, if you say yes, then you're able to see here who performed the test, HTS provider or self-test. If you say no, then it will just move. In our case, let's just say no. Then this is where we fill in the risk score for this patient. And this is where machine learning will come in, as Otieno had mentioned in the introductory slides. So we can do a risk screening. Has the patient have ever had sex? The moment you say yes, you see other questions come in. If you say no, then it will close the other question. So for our case, we'll want to say yes so that we see how we can generate risk of using machine learning for our case. Is this patient sexually active? Let's say yes. Has the patient had a new sexual partner? Let's just say yes so that we see how this machine learning works. Is partner, HIV status, we just say unknown. Has the patient engaged? Have you engaged yourself in a protected set? Let's say yes. For this case, if you say yes, then again, you'll be able to define how many sexual partners you've had sex with in the last 1 year. If you say no, then that place will be blocked. For our case, let's say yes. Let's probably say 4 partners in 1 year. Does the patient engage in sex under the influence of alcohol? Let's say always. The patient is always probably drunk or something. Have you ever had unprotected sex in exchange for money? Let me say yes, of course. Have you recently had any incident of condom burst? Let's say no there. Have you engaged in unprotected sex with someone you do not know their HIV status? Of course, yes. If you say no, you see those options. If you say no, you can just try them even on your end. But if you say, in our case, we'll just say yes. Have you had unprotected sex with someone who was HIV positive? We can say no because we didn't know. Then have you ever had any non-medical procedure? Let's just say no here. Then we have violence screening. Has the client recently experienced any violence? Let's say no. Any PrEP? We can say this patient has never taken PrEP or PEP before. STI screening, let's say yes, this patient has had STI in the last 3 months. Then we have TB screening here. So has a client been screened for TB? Because HTS, we normally screen our clients for TB. Then we say yes, any coughs, let's say no coughs, no weight loss, or no night sweat. The moment you say that, then the system will automatically give you a status of no TB signs. So eligibility for referral, this patient, before we do that referral, we can get a risk score for this patient. This is where I mentioned we have machine learning that will be able to score for us this patient, to be able to categorize whether this patient, if they are tested, they are likely probably to turn positive or not. So we can go here to generate risk score. If we click get HIV risk score, then we'll be able to see this is a high risk client, and it will score for you here high risk. All right. Then here you say patient is eligible for testing. So the moment you select, you get your risk score, then you can continue to say, do you recommend for this patient for testing? You say yes. Then why did you recommend for testing? This is where you can choose, because for our case, we'll choose a machine learning risk score, or if the risks are low or medium, you can the healthcare worker still feels, because of the question that the patient has given you, feels that they're able to, they want to test this patient either way, whether, because then you can choose the healthcare provider discretion, or based on risk screening findings, or machine learning, or even the guidelines. So it's not restricted that you have to follow testing as per the machine learning risk category. Okay. Just give me a minute. Okay. So if you go, let's fill this one. We are testing this patient based on the risk score. Then it will ask us if you want to refer this patient for testing. So when we say yes, you refer them, then you go ahead and save this form. So that's the way we fill eligibility screening form for a patient. Okay. So there are patients who score low, but you, as a clinician, you will be able to make that decision to be able to whether to test them, to go ahead and test them, or refer them for other preventive services at that level. So the moment once we fill HTS eligibility form, the next form that we are going to fill, because we've referred this patient for testing, we again come here and fill now HTS initial form, which documents testing and testing results. As you can see from the forms, from the clinical forms, whatever we have filled, the eligibility screening form has disappeared. The moment you fill a form in that encounter, that form disappears from this list of forms. But I think probably after 2 days, it will show us the date that the form was filled. If you come the next time, you'll be able to see a date here where you are seeing last completed. You'll be able to see an eligibility form with a date when that form was filled. For our case, we'll again go to HTS initial form and fill the form. So these are just the visit dates and the person filling it and the facility there. Then we go to next, where we're recording the details of the patient as we've tested them. We'll pick here general population. We'll pick our patient do not have any disability. Has the patient ever been tested for HIV? We had said no. In the last self-test in the last 12 months, we again said no. We'll pick this setting. The patient is being tested in the facility. We have an option of picking community patients, if those who are doing outreaches. But for our case, we'll pick a facility testing setup. Then the approach is PITC for our case. And then the strategy would be still PITC. But we have an option of picking these other options here, strategy, depending on where you are at. Then the entry point in OPD, just the way we are done. We had screened this patient and there were no signs for TB. So here we want to ask if the consent was given. If you say yes, then it will ask you which client are we being tested, is it individual or couple? If you say no, you see that one will disappear. But in our case, let's say yes, because we want to test an individual patient. So once you reach here, then we'll be able to pick the kits that we are going to use to test this particular patient, depending on the test kits that we have in the facility. So for on the screen, you can see there are 2 tests available, TrinScreen and Determine. And as we are aware, we have new tests that right now we are doing 3 tests in a facility if we are using TrinScreen. But there are facilities that still have Determine. So if a facility has Determine, you can still use the old protocol that was there. But if your facility now has transitioned to new test kit, then we'll have to pick TrinScreen. TrinScreen. Then we have 2 more tests. They are not in this test hub. We have dual testing, and then we also have a kit name called Standard Q. Standard Q is the one that is coming to replace the dual kit that we are using for testing pregnant mothers. But Standard Q in a facility instance will have all those 4 kits. But for this instance, I don't have in the 4 kits under this instance. So the Standard Q is coming to replace the dual kit. But the only difference is the Standard Q is you're also able to test the pregnant mother and even their sexual contact or their spouses in our case. So for our case, we'll pick the first test, which is TrinScreen to test. And then we put a lot number. Then we choose an expiry date. Let's just choose a date for next month. Then we will be able to document results. If we say this, the tests are turning to be positive. So if this test is positive, then we'll end it here. We'll only use this one test kit to test. But if the test is positive, then we'll have to use all the three kits to test this patient. So in our case, I will pick a positive test. All right. Then once I pick a positive test, I say results have been given. Okay. Client referred for other services. If you say yes, then you can pick this patient is being referred for, because this is a positive patient, is referred to be linked in these facilities. But if the client is negative, you can also refer them to other prevention services. So in our case, we'll just refer a patient to this facility for purposes of linkage. Did we pick a positive test? Okay, sorry. I think the first test we're supposed to pick a positive test. As I said, when you pick a positive test, then now we'll have the next kit appearing, okay? So the first kit is TrinScreen. The moment we have a positive test, then we'll have now an option to pick the second test. As I said, if we are using the new HTS guideline, we'll have 3 tests that we are currently using. I think majority of counties have started using this current one, and this one is we have to do 3 tests. Then the second test we pick here is 1 step. If we pick 1 step, we put let's key in a lot number there, and then we will also assign them an expiry date. If this test is positive, the second test is positive, then we'll go to our 3rd test, which is, we will go to a 3rd test and pick a 3rd test, which is an FR, all right? But if the second test is negative here, if the second test stands to be negative, then we'll be able to now pick the 3rd test, we'll pick a TrinScreen. We'll go back to the first test that we already picked, okay? But in our case, I think I will only pick the second test to be positive so that we can use both the 3 test kits that that I already mentioned. So I'll put a lot number and again an expiry date. So from here we can see we've used all the 3 tests we've used a TrinScreen. We've also used a 1 step, and we've used an FR as the 3rd test. And all of them, the results have turned out to be positive. Okay. Once we finish, we'll be able to close. Okay. Okay. You can see if you have there's a place you've not all where we have asterisks that they are mandatory field that you must fill. So this client of ours, we needed to refer them to this facility for purposes of linkage to ART services. So we'll save there. So that's the process of filling the HTS initial form and documenting all the results of this patient of ours to in the form. So we fill HTS eligibility form. We've done HTS initial form. Again, after filling that, the initial form, you won't be able to see it in the clinical forms. You'll only be able to see it in the next visit and with a date where the last date that it was filled. So the next step that we'll be able to do is to fill, because our patient has turned out to be positive for all the 3 tests, then now we'll be able to now fill a retest form. Depending on the, again, setting of the site of the facility, there are clinicians who are doing retest, or there are a second tester who will be able to again do a retest when the patient turns positive. So the retest form is just similar with the other form that we fill. So I'll just go quickly for purposes of saving time. So our patient was a general patient, did not have any disability, had not been tested before. It was a facility setup. We'll pick PITC as a strategy, and as an approach, we'll pick an entry point is OPD. No sign there. This patient consented for testing. It's an individual. Then we'll just repeat exact. We'll use the same 3 tests to just fill, because those 3 tests are positive. I'll just, for the sake of our patient, I'll again just fill quickly. So we'll do a train fill there. This one will give us a positive kit. And then the second kit is 1 step. Let me pick expiry date. Then the results are positive. Then we pick the third kit, which is an FR with that lot number and the expiry date. Let's pick the expiry date. The results are also positive there, as they can be given, and it asks you if these results have been given to the patient. You say yes. This patient has been referred. It's referred to CCC for care in this site. Once you do that, you just save this form. So that's the way we fill a retest form. If you can see on the form again, we have HTS linkage form that was not there initially. When we began, this HTS linkage form was not there, but the moment this patient turned positive, the form dropped. And now we are able to fill this linkage form of our patient who is HTS here. So after retest form, now we want to fill linkage form for this for our patient. We'll say this patient was referred within this facility. Then we'll be able to fill a CCC number. We'll be able to give them a CCC number depending on the arrangement at the facility. Then you will be able to identify this patient was handed over to which particular healthcare worker. If you're handing over to a clinician or a nurse, depending on the setup of your site, then you need to hand them over physically and put the name of the patient, the healthcare worker that you are handing over to, the cadre of this healthcare worker. You say, this is, I was handing over to Adeline, who is a clinical officer there. Date enroll, you pick today's date, and date ART was initiated was today. If you have any remarks, then you can probably put your remarks there and go ahead and save this linkage form. So we can see that those are the processes, those are the forms that we use be able to link to document HTS activities in a facility. If you want to be able to see what you have done or the forms that you have filled, then you would come to visit and check on encounter. If you go to encounter form, you will be able to see all the forms that you have filled here, the dates, the forms, and even the provider who was filling those forms. So that's the process of filling the form. So I'll just go next to how we feel relationship of this patient. We have a different relationship. On your right, when you are on the patient summary, you'll be able to see on your left panel, below here, we have relationships, okay? So if relationship, we have 3 categories. We have family relationship, we have PNS. This is where you are doing contact listing for purposes of testing your contacts. Then we have others. So if you have family, if our patient who is HTS, as you are able to the spouse or even the children, this is where we list them. If you come here, you'll find this page blank, then you just add. If you say add, it will take you to a page where you'll be able to search. So in order for you to list link this relationship, the spouse must have been registered in the system. So your work will just be to search. You'll just be to search for this patient so that you can link them. You see John Cook that have been linked here. This is the John Cook here. So you must make sure that a spouse is already registered in the system for you to be able to search them and link them to this patient. So John has been linked to this patient. So that's where you fill and save. Once you save them, you'll be able to see family members here. So this is a spouse to our patient, and this is also a child to our patient. The same linkage you also do to a PNS. You can also link their sexual contacts here. You just add. It will take you to where you'll be able to add their relationship and just save. So this is where we link them. And if you want to view you want to view their contacts, you'll be able to go here on the overview of our patient here, where you see show more. You'll be able to see contacts that you have listed here, the relationships. You'll be able to see this as spouse, a partner, like that. Though this was wrong, we can always edit. I can see there's a hand.
Adelan, I think we'll just proceed. We will allow.
Okay.
Yeah, just proceed. Yeah.
Okay, so this is where we do contact listing, and now you can arrange with the patient how they can come and for other services. So if the patient comes, this is you can also navigate to Mr. John just using our patient HTS here. If you click on John here, you'll be able to go to John's page and just give them the other services the way we've done for our HTS patient. If you want to navigate back, then you can still go back to our main patient who was the HTS in this case. So I think I'll end it there for that process, and I want to hand it over for Lydia before we go to report. So Lydia for the next session.
Thank you very much. My name is Lydia Mwangi, and today I'm going to take you through case manager, how to link a case patient to a case manager. First, I would want to introduce who is a case manager. A case manager can be a peer educator in a facility, or a healthcare worker, clinician, or a nurse, depending on the setup of the facility. And what is the key mandate of the case manager? A case manager is to keenly or closely follow up clients depending on the situation or his or her case that is presented. And the cases that the clients that present high VL or risk of IAT or return to care or other chronic illnesses, those are clients that are easily linked to a case manager. So for me today, I'm logging as a case manager. I'm a nurse, hence this is a case manager at this facility. And my name is Patricia Briat, and for Patricia, we will have a case. We have a client that we want now to link. Allow me to link a client from the system. I have a client here called Mary. And my client here from the care panel has been enrolled to, from the care panel, the client has been enrolled to HIV and TB. Hence, this client requires a linkage to a care manager in the facility. From the home panel, there is on the left side, there is a linkage service. Once you click on the linkage service, there is a case management. Once you click on the case management, remember, being a case manager, every case manager is able to see the client, the cases tagged to them. Me being Patricia, I can see I'm tagged to 4 active cases, and I have a discontinuation of 5 cases. I can be able to see the client the cases that I'm still enrolled to me. For me, I want to show you how now I can be able to tag my client, Mary, to Patricia, who is a care manager. At the right hand, there is an add case. Once you click on add case, you can be able to see the case manager is Patricia, and I can be able to search for my client here, who is Mary. And I can be able to add the relationship. I want to be the case manager. And I can be able to put the date as when we start. I've tagged the case to Mary. This is today. The start date for this case is today. And I can be able to document the additional notes. This is where you can be able to write the condition of the client when you get, maybe you can say, had high VL, or return to care, or the patient has a risk of IAT. You can be able to document it at this particular place and save. Once you save, you can be able to see Mary has been added as part of the case that Patricia is following. So Mary has been linked successfully to Patricia, who is a caregiver, who is a care manager at this particular point. Now we want to fill up the forms. We want now to document the IAT investigation form or home visit form, checklist forms. From the far end, the right far end, there is a section for forms. You're able to find the 2. Currently, we have these 2 forms, which is IAT investigation form, and we have home visit checklist form. We want, as I indicated, Mary has a high VL, so we want to come and she's of high IAT investigation form. Once you click on the high IAT investigation form, these are there we have 4 investigations offered here. There is appointment management, there is assigning case manager, there is a client literacy, and the differentiated service delivery. I will go with, one by one so that we can be able to follow up. For the first investigation, that is the appointment management. There are also, we have 5 investigations that we can be able to follow up for this client. First of all, you can be able to, we can be able to do an individualized discussions with the recipients to care. We can give an individualized discussion, and we can also do and agree a plan if the recipient of care cannot honor the given appointment. This is an agreement you're having with the client. And then you can ask the client if the client is willing to receive reminders. And if the client is willing to receive the reminder, this is when you can do either by SMS or follow-up over call. If you say by SMS, we can be able to enroll. You can ask the client if the client is enrolled to Ushauri. Ushauri is a mobile application. It's an mHealth application that we are currently having, whereby we send client reminders on appointments so that they can be able to get appointment through their mobile phone. If the client agrees to this, it can either be yes, he has agreed or no, he's not enrolled, you can be able now to link the client to the Ushauri enrollment form. You can also have an immediate follow-up via the phone call on the days missed appointments next day or up to 7 days. You can also have a physical tracing by the volunteers if not returned after 7 days. This physical tracing can either be home-based, whereby you can be able to go and trace the client from the area of location. Then we can be able to give an appointment management invitation. You give this client an appointment. After how long are you going to see the client next? Maybe you can give them after 2 weeks or 1 week. I'll give my client on 15th. That is when the next appointment can be able to see. The second one, I can be able to assign this client to a case manager. At this particular point, I am able to, when am I, is asking me the date, you're assigning this client to the case manager. And this client, we are assigning the case manager today. So the assignment is registered as done today. You can also do a client literacy, whereby the EAC, is there any EAC recommendation? You can either say yes. If there is yes, you can be able to fill the EAC form. If or no. For the now, our client, you can say no. The client enrollment is a support group. Is the client enrolled in any support group? For my client, for today, you shall say no. The client is not enrolled in any support group, and then we are going to give the same date. We are going to give the same date of intervention. Then we can save the form. Once we save, that is completed. We have completed doing the first form, the IAT intervention form. Then now we can be able to see the home visit checklist form. When you're doing the home checklist form, remember we are doing with the IAT, we agreed with the client I can be able to do a follow-up. We can be able to do home follow-up to check on the client condition. And when you're filling the home checklist form, these are the assessments that you want to see. Are they the assessments that are limiting the client for the VL to be compromised? The first one is a patient-independent daily living. This is the feeding. You can check if the feeding is okay, the grooming, if the toileting is okay. Then you can check, are the patient's basic needs being met? These are the barriers that we are assessing the barriers that are maybe contributing to suppressing of the viral loads. Maybe there is clothing and shelter. We can say the clothing is being met and the feeding is okay and they have a good shelter. Does the patient have a sexual partner and has disclosed been done? Yes, we can say the disclosure has been done. Has the patient disclosed the HIV status to other household member? We can say maybe no, it has not been disclosed. Has the patient, how are the patient's ARV being stored? Remember, at this particular point, we are at the patient's home and we are assessing the situation of the patient. So here I can say they are not well stored. Another thing, how are the ARV taken? Assess the last taking of the medication. Not well taken. Remember, timing of the medication is key. And the reason why we are doing follow-up is because so that we can be able to rectify and work closely with the client. So the first assessment, we are noticing that the medication being taken, the timing being taken is not being keen. And the storage of the medication, some are supposed to be refrigerated, they're not refrigerated. And the timing, skipping of medicine, the time being scheduled for taking the medicine is skipping. So at this particular time, we are noting that they are not well being taken as required. And here, does the patient receive social support from the household member? I can say yes, because we can, what support is given. As we had listed before, we saw that the client has food, so we can see basic needs are given. Is a patient receiving social support from the community? We can say yes. What social support? Motivation. Maybe from the peer groups. Is the patient linked to non-clinical services? Let's say legal, nutrition, spiritual. For my client today, I will only say linked to spiritual, and maybe nutrition, as we noted, is the food is being catered for by the family members. If there are any other that are not listed here, you have a way of, under the others, you're able now to capture anything that is not listed here and is being given. Does the patient have mental illness that needs to be addressed? Currently, no. Our patient today does not have any mental illness that needs addressing. Is a patient suffering from a stressful situation or significant loss or grief? I can say maybe yes, my patient lost a loved one, or my patient has not been stable at the moment because of losing one of the loved one. Does the patient use drugs or alcohol? Allow me to say yes, my patient has been high alcoholic, hence one of the contributing factors to the viral load being suppressed, and we want to correct that. We want to work closely with the patient so that we can be able to correct that. Is the patient having any side effect of the medication? No, the patient is not having any side effect. But in case there's any side effect, when you say yes, you're able to document the medicine taken and the side effects received from that medication. Once that is done, once that is filled and completed, I am able now to save and close. I've closed that. Now we were able to do documentation for the high IAT intervention form, and I was also able to fill a home visit checklist form. When you come back to the linking, you'll be able to see Mary, who's been successfully been linked, and you can be able to see the cases that now are active 5 for that has been followed up closely. From here now, I would like to show you how to discontinue. Now the client has now been followed for a period of time and the viral loads has been suppressed and stable, and the client needs now to be discontinued from the program. What you do, at the far left, there are 3 dots, written options. Once you click there, there is a red button that tells you to disconnect. I want to disconnect now Mary from follow-up, and this will end the relationship. Are you sure you want to proceed on? And I will check on the dates. Today's date is when I want to discontinue. Once I say save, automatically you will notice Mary has been discontinued. I no longer have Mary as a caregiver, as Mary Patovin, and on my discontinued cases have increased. I have now 6 discontinued cases because Mary is now documented as part of the cases that have been discontinued. I think that is it from my end. I want us now to do the reports.
Thank you, Lydia. I'll take us through the reports part. So for reports, as you are aware, reports are still under here. I'd said we had these buttons here you can see. So if you want to go through reports, we will still go back to our 2.x. We are yet to move reports on this other side because of facility-wide, and once the design is done and we are done with all the modules, then we'll be able to move the report. So if you want to look at the reports, to view reports, we'll be able to just still go back. You click on this, it's got those dots, then you'll be able to see KenyaEMR Home. If you click on KenyaEMR Home, and this is a familiar screen that most of us are familiar with, and this is where we'll still be able to access our reports. We will not be able to access all these other modules because now they've been moved, but reports are still actively being accessed through this part. Once you go to reports, HTS reports are still just the same. You'll be able to find them here. We'll be able to find the HTS monthly report. We're able to see HTS index testing registers. We're able to see PNS details. We're able to see HTS register, just the exact register, the replica of the register that we have on the at the facility level. We're able to see also HTS prediction reports. We are also able to view HTS confirmatory register, linkage registers. So and then we also able to get reports here, except MOH 731 reports. Then we also able to just get MOH 71 for KDOD staff that are here. Their reports are normally separate. So all the reports are just where they are. I don't think we have any additional reports for HTS. So this is where we'll be able to generate reports. If we go to HTS register, for example, we can start with the HTS register. If you click on it, then you say request. Then you'll be able to choose the date range where you want which date range you want your report from. Let's, for example, choose we want an April report. You are running a report at the end of the month, and we all know before we run a report, we normally must create tables. If we have data officers on the call, I know they understand we have to recreate tables for us to be able to capture everybody that was in that month. Then once we choose a date, then we say request. If we say request, we had run a report, and that was quick. Then it will give you an option here, or we can either view your report just like that. You're able to view to make sure that your patients are well captured. You can run as a CSV. You can just download this report in a CSV if you want to do some analysis, or you can do an Excel version. In our case, I'm going to just do an Excel version for HTS register. Otieno, you can still see my screen for HTS register. Please confirm.
No, not really. We can see the EMR.
EMR, okay. I think we'll, let me stop sharing this, then we can show how the register looks like. So this is, are you able to see Otieno, the register?
Yes, yes.
Okay. So let me just try and zoom in. Zoom out. So this is what we are able to get, just a replica of HTS register. So this is, I don't know if it's visible on your end. It's a long register, so we are able to generate this register at the end of the month and just get all the details that all the details of our patient that we are able to document. Then we also had a HTS report here. We have an HTS prediction report here. Are you able to see this, Otieno?
Yes, yes.
Okay, so this is our HTS prediction report. So what I wanted to show is when we do prediction reports using machine learning, this is the report that we'll be able to get when we do eligibility screening. And as I mentioned during demo, there are patients that are when we score them, they score high. They are high risk patients, but then when we test them, they turn out to be negative. Once they are negative, then you will be able to refer them to other preventive services for risk reduction. So in this report, you will be able to also be able to get, you're able to get those patients that have been documented where they were referred to. Like, for example, this particular patient, you can tell this patient done. Yes.
Sorry,
You're
I think
able to see?
the register we are seeing is the HTS register.
Okay. Not the
Yeah.
prediction report. Okay.
No.
Let me just share. And now? Whatever you can see the prediction report.
No, it's still the HTS register.
HTS, okay.
No, Adeline.
Yes.
Adeline, it's
yes,
okay. I think
yes.
Otieno's network could be the
The
problem
problem.
because we were
Okay.
able to see the prediction register. I mean report, sorry.
Okay, okay.
Yeah, so just
Okay, that's okay, Songok.
So you can bring it back
Yes.
because I think you pulled
Okay.
it down. Yeah.
Okay, okay. So this is the prediction register, and as I was saying, we're able to document. If you document, you're able to document even the services that a patient was referred to. We can see this particular patient was referred for PEP here. Other risk reduction counseling was done. So those, this is where we get that report. Then we had another report that has HTS summary. Songok, you can see.
I'm still seeing the HTS prediction report.
Okay, okay.
Yeah, so you need to exit
So,
let me share.
okay.
Yes, that's okay now.
That's okay. So this is the just HTS report that has summary as per age and sex disaggregation. So these are just some of the reports that we're able to see that I wanted just the team to appreciate the reports that we have. I think I'll stop sharing. I just wanted to show how to generate those few, the few reports that we have. The reports are just the same. I know there are probably few additions, like the prediction report we have seen. So I think I'll just stop sharing my screen there.
Thanks, Adeline. Confirm that you're done.
I'm done, Songok. I think I'm done.
Oh, okay.
Yeah.
Okay. Thanks. But you wanted to make a comment?
No, not really.
Okay. Thanks. So thank you very much, Adeline, Lydia, and Otieno. Of course, Otieno, for taking us through the slide deck just to prepare us on what was to come in form of a demo. And thanks, Adeline and Lydia, for taking us through the demo. I think in the spirit of status neutral, we've seen our workflow in terms of HTS, how we are able to link those who are HIV positive to care treatment, and how we are able to link the negatives to prevention. So at this point, I want us to, because I really do not want to belabor so much on what the team has taken us through, but I want to open it up for any questions. I know you've been asking questions on the chat, and I'm glad the team here has been able to respond to most of the questions. I know there were questions related to NUPI. There were questions related to issues around testing, that standard queue not being available. I think this is something that had been raised earlier, and the team is working on it. Thank you, Eric, for responding to that. Thanks, Diana, Frida, Otieno, and Ogutu for sharing the toll-free line, just in case you have any issues, because sometimes in such forums we may not be able to, or we may not exhaust all the questions. You may encounter any other challenge or any other errors during your day-to-day service delivery at the facility level. So we have a toll-free line that is available for all of us to always reach out to the team, and they will always be available to support, of course, during the day from 8 to 5. I just want to quickly run through and check whether there are any pending questions. Oh, thanks, Andreen. I can see you've also been able to respond to some of the questions. Feel appreciated. I'm not seeing any pending questions unless, let me see the ones that were posted a few minutes ago. Before we go to the answer, I've seen your hands are up. So let me just quickly run through the chat to exhaust the questions. Yeah, so Adeline, Emmy is asking how you managed to pull the HTS register from EMR. Maybe probably you could take a minute or two to probably demo that. Then please showcase how to get the register again. Well, yeah, that's the same thing. I think something that was raised by Emmy, something that is raised by Dorothy. And then Maswage, I hope that is correct. Once you've downloaded the HTS register, the top column, it does not outline the lot numbers, expiry of the various kits. Maybe you can also respond to that, whether that is true. And the reports, can we have clients due to cervical cancer? I guess probably maybe that Michael meant to have a report like listing clients who are due for cervical cancer screening. I guess that's what he is asking. Yeah, I think most of the others have been responded to. So maybe Adeline, you can make a comment. You can just quickly pull that the register. Then I'll go to the people who've raised, or the participants who've raised their hands. I'll request Ogutu or Otieno to help me assign. Allow the participants who've raised their hands the mic. Right. So Ade, you can go ahead.
Thank you, Songok. I'll just again take us through where we get the report. As I said, our reports are still on your right navigation panel here. We have these are called what? We have buttons called KenyaEMR modules that have other modules. Among those modules, we have KenyaEMR Home. When we click on KenyaEMR Home, it will take us back to our previous version of KenyaEMR3.x. If I click here, then that's where we are getting the report. And as I said, reports are still, they've not been moved to the new interface for 3.x. They are still here at the back end. So you can still go back and get your reports here. I hope the person who has asked is able to see. So this is just where we used to get the reports in the older version. It's still the same place. So when we click on reports, we'll be able to see all common reports here, as you can see. I hope my screen is visible, Songok.
Very, very visible.
Okay, so we are able to see various reports depending on your program area. So our case was HTS. So in HTS, we'll be able to see various reports, starting with just this above, starting with the HTS monthly report. You can see here, I was able to show this report disaggregated by age and sex. When we ran the report, you just click on that report. If you click on it, it will ask, we have two buttons here, request report or back home. So if you say request report, it will ask you the date range where you want your report from. Is it monthly, a specific month you want to get your report? And in our case, I'd run an April report. So I'll start 1st of April. And 30th of April, and just say request. If you say request, this report will be able to process up here and drop down here. So it is at this below here where you are able to now download your report. If you download it, it will go to your desktop or your downloads. All right. So this report, you're able to view it here using that view button. You can view that report like that. for HTS report, or you can run a you can download this report via CSV. CSV is just also an Excel version, but it's better when you want to do analysis with a CSV. Then we have a normal Excel report. So you can also download via Excel. If you download, you'll see a download, but here, you can see the report as downloaded here, Songok.
Yes, so I think,
yeah,
Adeline, you can quickly
yes.
transition to the register.
Okay, so we'll
minute.
do the same for HTS register. So HTS register is here. So you also just click on the register, and then you do you request for that report. You choose a period that you want to run your report. If you say, let's say, in the month of March, you can just navigate with those buttons, and then you say request for report. If you request again, this report will drop below here. So you can see it's processing, and this report has dropped, all right? So here in the middle, you'll be able to see the month of the report that you are running. Here we can see 3 April report, and then we see this one for March. So we'll be able to just do an Excel. Here it will drop here, and we'll be able to just generate your, see your reports just the way it is in the facility. So Gok, I hope you are clear up to there.
Yeah. So you can now exit. Yeah. You can now exit
Okay.
KenyaEMR and then now share the Excel just for a minute.
Okay.
Yeah.
So that's the way you can see my screen for Excel.
Yes. I think that's perfect. I think that's quite useful for Dorothy, Amy, and probably anyone else who may not have grasped the process, the whole process. I think the most important bit is for us to note the fact that for you to access reports currently, you need to go back to KenyaEMR, the older version of KenyaEMR, that's through 2.x, for you to access the reports. And because that is the only bit that hasn't been moved to the new platform, but I think the team is working around the clock to ensure that everything else is moved to 3.x. So thank you very much. Sorry. Yes.
What I didn't share is how to get a report for what Lydia had shared on case managers. If you want to get that report, then you would go to active patient on ART. You will be able to get patients who are linked to a case manager on that same report for active patient on ART. I didn't show that, but it is there. You're able to see how many patients are linked to a case manager, a particular case manager. Thank you.
Okay. All right. Thank you very much, Adeline, for that demo. So we can quickly take questions. I think I can only see 3 hands up. So Oguto or Otieno, I hope you've allowed the 3 participants to. We can start with Ladislaus Ouma, then Faith, then we finish up with Jadwong Oyugi. So Ladislaus Ouma.
Yes, thank you, Songok, and thank you very much, Adelaide. Am I audible?
Very audible. Go ahead.
Thank you. 3 things. Thanks, Adelaide, for the prediction report, because the prediction report is what we can use as our OPD workload register. But now I think there's one column which is missing, which needs to be placed there, like the column of eligible, because we only have people, the prediction report, prediction score, but now you don't have whether they were eligible or not. Then you go direct to testing. So we really need a column for eligible, so that we have that cascade complete. We have the number of people who are seen, screened, how many were eligible, and how many tested, and the testing results. The second thing is about the PNS. PNS, because of time, we might not do it, but if you do the newly identified positive, you add the contacts, it will auto-populate to that HTS index testing register. But if you rescreen a client who is already existing in CCC and maybe by any chance was not screened initially, you screen, you attach the contacts, but will not appear. You will not get that client in the HTS index testing register under the reports. The third one, which is the last one, is about the retest register. The retest register, if you view, because most of the facility staff only have right to view, the tablets will disable not to download the Excel. So in the retesting register, you are not able to see the batch number, the expiry date for the test kits. So I think that one needs to be considered, because in the initial, the HTS register, when you view, they are there. But in the retest, they are not there. Thank you. Back to you, Songo.
Thank you. Thank you, Ladislas Zauma. We can go to Faith very quickly so that you can respond to the questions. Faith?
Okay, good evening. Thank you, team, for the nice presentation. I'm Faith Kapoka. My question was about PNS. If you screen the client, you in the family testing, you can create and add. But for PNS in 3.x, we are told that you cannot create the client first. You just go to add. And if you had, you cannot submit it. It bring that fix the error. So I think you can look about that so that we are able to add the PNS contacts, sexual contact to the index client. We are only able to create for the family testing, but family and add, but for the sexual partner, we cannot able to add them direct to the index team.
Thank you. Thank you, Faith. We can go to Jadwong or Yogi. Or Yogi, if you're speaking, we can't hear you. Meanwhile, can we go to Judith? Or Yogi, you may need to check on your mic. We can't hear you. Judith?
Good afternoon.
Good afternoon, Judith. Go ahead.
It's Joanna. So
No
I have
problem.
a question.
Go ahead.
I have a question. Under index testing, if you list the contacts, more so for the children, you will see the children. You will see, but you won't see the HIV status under family, under PNS family.
Okay, thanks, Judith. That is noted. Maybe you can lower your hand, Judith. Let's take one from William, then we respond to all of them. And I'm hoping that Eric and team, you are taking this because most of the questions is directed to your team, Kezia, Magdalene. You'll be able to respond to most of the questions that have been raised. William, you can give the mic to William. Then we respond. William, you have the mic. Go ahead. Okay, can we go back to Oyugi? Oyugi, I don't know that you're able to speak now. Yeah, it seems Oyugi is having challenges. Oyugi, what you can do is because you can't, it seems like you have a challenge with your mic. You can post on the chat. We'll be able to respond to your question. Yeah, because I can see only Ambrose. Let's take one from Ambrose, then we respond to all. Ambrose.
Yes, good evening. My name is Ambrose Innocent. My concern was the one that Ladislaus talked about, the rescreening about the contact. So I'm not going to repeat that question. The second one is on the retesting register. I don't know whether I'm the only one that has seen that. On the initial register, we have a provision for the 3 kits, but on the retest register, we have a provision for just 2 kits. I don't know whether you've seen that, and basically the PNS part of it where when you rescreen the contacts and add them, and then you run the index testing register, you won't see it. It will give you a 0 report. Thank you very much.
Okay. Thank you. I think we can respond to those. If you've asked your question, you can lower your hand so that we can keep check on who else who still has some questions. So I think most of these questions are directed to the BA team led by Kezia. So I'm requesting that Kezia, maybe you can respond to this. Okay, Eric, I know I think I've seen Eric in the call. Eric, maybe you can respond to these questions. Then Adeline, Otieno, and Lydia can just make a comment on the same. Maybe we can start with Eric.
Thank you, Songkok. I know Kezia might not be in a position to unmute and talk, but let me respond to some of the questions. And I know there are a lot of questions we've been responding to in the chat area. Maybe before I even pick the first issue, just only to let you know that any issue regarding to a report, we very well do it verification using the existing data within the facility. So some of us who are reporting maybe a register is not populating, it's 0. We might want to reach out to your facility and be able to connect to that particular facility and be able to investigate the reason as to why you're not able to generate a report. So there was a question on the prediction report missing a column of eligible clients to make that cascade complete in that particular report. I think this is a request from the first, that was Ladislas. So we take note of that. Then the other was the second question was on the PNS rescreening clients, whereby you stated that they are not appearing in the register. These are the ones who are coming for risk, who are being rescreened, meaning that they were existing within the facility. And again, allow us to investigate the reason as to why they are not appearing. And we may reach out to you, Auma. The other one was on the retest register. That is when you view, you can't see batch number and the lot number. And you specified this is not on the desktop for those who are using either laptops or the desktop, but for those who are using tablets, this is in the tablet view. Again, allow us to look at how the configuration on how you can be able to ensure that you see the entire columns as you can be able to see using either a laptop. So we take note of that, Auma. Then the other one, again on the PNS, on contact listing, not saving the form. So we've seen instances whereby some facilities are able to save the contact form. Even the test servers that we use, we could be able to save that form. And these are some of the cases, maybe Faith, we are saying that we would like to connect to your facility and be able to investigate the reason as to why you can't be able to save that contact listing form. So Faith, we've shared in the chat our toll-free number, all our means that you can be able to reach out to our help desk. Kindly do so that you can be able to help you and be able to save the contact listing. Then there was another question on the index testing that children listed, you will not see the HIV status. So again, we want to investigate that and be able to see once you pick why the reason as to you cannot be able to see the status documented. Then the last one that from my end that I picked was retesting register, whereby it has only 2 provisions for 2 test kits. This is noted. We'll be looking into it and then ensure that we ensure it has even the third, can be able to record even the third test kit. I think that's all on what Songkok can documented. I don't know whether my team members want to.
There was, so the Eric, there was one regarding the PNS. I'm not sure whether you've responded to. I think there was a concern. I can't remember who it was. I guess it was, I can't remember the exact name. I think it was Judith, yes, regarding the PNS, where you can't create, according to the guidance, you need to create, but not add. But she's saying that when you create, I think they were not able to successfully do that. I can't remember the exact words that she had used, but maybe you can comment on that.
Allow me to comment this. We may even want to know the versions that each and every person maybe reporting an issue is using. And that is the reason as to why maybe to the entire team here I was stating we need to sometimes connect to your facility and be able to see how can we can be able to help you. There is a time using the relationship feature and you want to do contact listing, and the action that I think it was Adeline showed on creating, it required you to enter the 3 names. And that time you could not be able to save. We corrected and worked on that. And right now you can be able even to use that particular feature to do contact listing, even without being forced first to register that particular contact in the system so that you can be able to link them. So again, if you have that issue, kindly reach out so that you can be able to help you.
Okay, thank you. So we can take the last, because we have about 15 minutes to the top of the hour. So we can take the last 3. I can see 3 hands up. So we can start with William. William Opar. Lydia, sorry. Yeah, please go ahead, Adeline. Sorry.
This is Adeline. Sorry, I wanted Lady Laus mentioned something on rescreening of all patients under PNS. I think probably it's something that we would want to just do a keyway on to see, because he was saying they don't appear in the index testing register, the old patients. I think Eric didn't mention that. And something that I wanted to tell ladies, currently we are facilities that are implementing facility-wide. In the meantime, as even we look for a way forward to make sure we add columns for total OPD seen and those who are screened. We have included all OPD registers for under 5s and over 5s. So, and they are under that report. I didn't show where it was, but it is also in KenyaEMR for facilities that are using facility-wide. We're able to get the entire OPD report, workload for OPD. So that's what I wanted to add for those 2. So go back to you.
Thank you very much, Adeline. So I think we can then transition to the 3 hands that are raised, and I think that will be the last that we will take. So we can start with William. William Opar, if you are able to speak, kindly unmute. Meanwhile, as we wait for William, we can go to Glory.
Hi everyone, I'm Glory. I had a concern about the PNS. While adding on the other index, you go to a relationship, then there's an option of search the patient, and then there is another one for create the patient. Like creating the patient, and finish the baseline. And go to save, it doesn't save. What might be the problem? Maybe unless when you register that's PNS, then you go and search under PNS.
All right, thank you, Glory. Divina Mweperi. If you're speaking, we can't hear you. Divina. All right, fine, thanks. So probably, yeah, go ahead.
Okay, when I want to pull the prediction report, there is the ETL that you refresh first is when you'll get the report, but the tables do not refresh, so that it gives me less report compared to what I've entered in the EMR. So I don't know if you can help on that.
Okay, thanks. That is noted. And I think you can also reach out to service desk. They can be able to probably access your database and run the report to just investigate as part of investigating probably what the problem could be. Okay, I can see, okay, let me see. I don't know that there are any other hand up. Yes, Moses Andaro, we can take that last one, then we close. Moses?
Yes, thank you for the opportunity. I'm happy with the presentation. Mine is concerning the retest or confirmatory register. Many a times the providers are complaining that if the linkage register is failed, the confirmatory register disappears. And this one gives us a lot of problem because somebody complained, all my clients are linked, but we understand that the problem is that the disappearance of confirmatory register. Why should it disappear? Can it be worked on so that it is there in case it has not been filled in time, it can be filled later and the client is fully served? Thank you.
Moses, the register is disappearing. Anyway, sour.
Oh.
No, it's okay. Okay, I'm not seeing any hand up. So,
Songok.
Eric, Felix.
Songok. Yes. I hope I'm audible.
Very. Go ahead.
Okay. So I have three questions, and probably one of them was answered by Eric, but it was not clearly answered. That is the family line listing panel, where we are not able to see the results for the contacts who have been line listed. For example, children who are line listed. When you open the panel under the relationship, you will not be able to see the results for the clients who have been tested. Then number two, before the upgrade, we have clients who are previously line listed, that is other index testing. But after the upgrade, a good number of clients were lost. And up to now, I don't think that has been rectified. So probably something that you need to look at. Then lastly, again, under still index testing, when you put the register, the register for index testing, you miss a good number of clients. But now when you go to individual client level, you'll be able to see even the clients who have been line listed. But now pulling the register, you'll not be able to see these clients. So probably that's something also need to be looked at. Thank you.
Thank you very much, Felix, for raising that. I think, like Eric had said earlier, and I want to reiterate the same. I know we may not really be able to address all the questions in this forum here, but again, this is a very good forum for us to interact. But I would urge all of us to reach out to the service desk team so that they can be able to address some of those challenges that you are experiencing at the facility level. So I want to request Eric to make a quick comment regarding, I know he had already responded to most of the questions, but I want to request him to just make a quick comment regarding the PNS issues around the search and creating the patient, and probably maybe Adeline, you can make a comment regarding the prediction report. And then I don't know, this one of a register disappearing. I don't know whether Eric, you'll be able to respond to that, or the devs team. I don't know that there's anyone here who can respond to that question. Then the one that was raised by Felix, I think I would request that you can reach out to the service desk team so that they can be able to just investigate and find out why clients got lost, and probably why you're having issues with the family line listing. So maybe Eric, a quick comment, because we have about 7 minutes to the top of the hour.
Thank you, Songok. And I think the first question that, again, I've seen so many questions on the PNS section, and I think, and most of them, it's when about when you are listing your contacts under the index. Again, the question came up that the patient, when you pick the baseline, it doesn't save. So remember, I said there was a time we had an issue with that particular section. It was resolved. So we need now to get to the specific facilities that are encountering that problem to be able to know why still they are getting that. Because I know when the demo was being done, we could be able to save that form. Then, yeah, there is another issue that you talked about, a register disappearing. I don't know whether he meant a register disappearing, because if it's that, then we need to reach out to the person who has said that, and I would urge the person to call a service desk immediately after this we see why the register is disappearing, because I think it's something that for the first time I'm getting to hear about it. Then family listing missing. I think the results, I know now after the last person just reported that issue, I know now where I think they're talking on the panel whereby you've three sections: the family, the PNS contact, and the other. So I think under family, if you want quickly to see your family contacts, and I think this is where you talked about the children and you want to see their status, I think I know now we lack a column to show you the HIV status or the baseline HIV status. If that is now what maybe you meant, from our end, we acknowledge that we need to do something so that we add a column that you can be able to see the baseline HIV status. You talked about historical data. Allow me not to respond to that. I don't know whether Rajab might be in the call to respond to the historical data of those who are listed when we were using 2.x. and why we are not seeing them in 3.x. So, or maybe any other person from Palladium.
I think I'd seen Andrine, so maybe she can comment.
Yeah, then the last one I think you've mentioned. Anything to do with the report, maybe you lacking a good number of clients, because you talked about like listing registers, lacking a good number of clients. Again, it is good to reach out so that we can be able to work with a specific facility which is missing, and then we can be able to let or investigate where the issue is. I think I can hand over to Adeline and even Andrine, maybe to respond to the other questions.
Yeah, maybe Adeline and Lydia, because it seems like Andrine dropped. She's no longer in the call. But maybe one last comment from Lydia and Adeline before we close.
Songok, you had talked about prediction report. I didn't get the question on prediction report, because the last one that was asked by Ladislaus, I think we already responded to.
Okay. Anyway, I think what I would suggest is that let me see. Yeah, I didn't capture specifically what the question was, but it was in relation to the prediction report. So I would request that whoever addressed that question can reach out to the service desk team so that probably we can sort it out, and many other questions that we may not have addressed adequately in this call. So maybe if you have any other comments, Lydia and Adeline, you can probably just quickly make those comments so that we close.
No comment on our end, Songok. Maybe Otieno has comments.
Yeah. Otieno?
Maybe Songok before Otieno?
Yeah. Go ahead, Eric.
Yeah, we know we have so many questions under the chat, and if maybe you did not have a chance to voice your query, kindly put it under the chat. We usually use all those questions. After this, we'll be reviewing each and every question to ensure that we develop a system that works for you and which is user-friendly. So kindly don't leave without putting your question under the chat. Thank you.
Thanks, Eric. What Eric is saying is that the chat wall will still be available to the team. So in case you have any other questions, you can always post. The team will be able to review and get back to you as soon as the team can. Otieno?
Yeah, thanks, Songok. I think Eric has read my mind. I just wanted to emphasize what Eric has said, that if we didn't get an opportunity to respond to your questions here, we are going to address your questions separately after this meeting. We are going to have like a list of all the questions that have been asked and see how we either respond to them or we resolve them in the system. So I think that is very important. Then I've seen questions around how to access the recordings from this particular training. So we are going to download this recording and upload it in the YouTube channel. So check out YouTube channel tomorrow in the morning. You will find it there so that you can go through it on your own and get to understand how the workflow looks like. And again, lastly, I think maybe Songok, you'll talk about this, about the next training. We are having another training again next week on Thursday, and I think we'll send out calendar invites for the same. Yeah, otherwise, I want to just appreciate everyone for having time and attending this particular training. We hope to see you again in our next training on Thursday next week. Thanks, and over to you, Songok.
Thank you. Thank you very much, Otieno, for coordinating and ensuring that this is a success. So as we close, I want to request Diana To from Palladium, who is the capacity building lead, to make a few remarks as we come to the end of our meeting. Diana? I think I'd seen Diana in the call. Oh, she dropped.
Hi, Songok. Confirm you can hear me. Am I
Yes,
clear?
I can hear you loud. Yes, I can hear you loud and clear. Go ahead.
Okay, thanks, Songok, and thanks everyone for taking time to join this meeting. I think it's not only beneficial to you, but it's also beneficial to us because we get to really get good feedback from you on how to make the system better, and also just ensure that we are responsive to your needs. So I just wanted to reiterate, I hope you just save somewhere the service desk number. It's toll free, meaning that the post has already been taken care of. So if you just have a phone, if you can just call that number, you won't incur any charges, and that would be prompt support so that you don't have to suffer having challenges and waiting for such meetings, so that you can raise the issues. So we appreciate, and thanks again for staying up to the end of the webinar. We are hoping to see you next week, as Otieno mentioned, as we'll be covering other topics. Next week, I think the schedule had been shared on the different topics for each week. So thanks again to the facilitators. Thank you, Songok and the NASCOP team, for helping us to moderate and also to lead these sessions, and also the Palladium team, Lydia, Adeline, and everyone else who was participating in this call. So asante and have a good evening.
Thank you. Thank you very much, Diana, for the support. I think we will end it there. Feel appreciated. Apologies from our lead at NASCOP, that's Dr. Lily. She wasn't able to join us. We will be able to communicate to you on the topic that on the areas that we'll be covering next week on Thursday, same time. So we are looking forward to interacting more with you, and would also want to request that in case you have any feedback, I know a good number of you have been reaching out and just giving us very good feedback, because that really helps to build the team that is delivering the message, and it also helps us to be able to be precise in what we are doing, and ensure that we build the capacity of everyone. And I think Diana has really touched on that in terms of just helping you and us to be able to deliver the content in the right way and in a manner that helps all of us. So at this point, I want to say thank you very much on behalf of leadership at NASCOP. We really appreciate your support. See you again next week on Thursday, same time. Thank you and bye.